Joining us now, former Democratic Congresswoman Donna Edwards from Maryland and former Republican Congressman Carlos Curbelo from Florida. Donna and Carlos, both MSNBC political analysts. We're grateful for both of you. Donna, what are the types of amendments that we might see in this vote-a-rama during this marathon in the next few hours?
Well, I think if you look, there are a whole range of amendments that are designed to bring certain senators along. Provisions, for example, for rural health care, other provisions around some Medicaid tweaks. All of these things are designed to bring individual senators along. There are some, for example, on energy tax credits. But, if you have to carve together a big bill, and it is big, adds $3.3 trillion to our deficit, then it means that there's something fundamentally wrong about this bill. And 11.8 million people who are going to lose their health care all across the country in every single congressional district in every single state. So I don't think the amendments are going to fix the problem, and we'll just see whether there's enough pressure on a couple more senators to realize, like Thom Tillis did, that this is a disaster for the American people.
Okay, Carlos, this comes just 24 hours after the Congressional Budget Office said that this bill could kick about 12 million people off their health care over the next 10 years. What's the political gamble that Republicans are making here, especially for lawmakers representing those more rural and lower income districts?
Yeah, Ariel, this is interesting because a lot of the people who could lose their health coverage as a result of this bill are probably Republican voters. We know that the president has done a very good job of bringing in lower income Americans to the Republican coalition. And that's the issue that Republicans are facing right now. You hear Josh Hawley and others talking about having to protect Medicaid recipients. So we're going to see that battle play out in the Senate today. Senator Susan Collins, we know, has prioritized trying to limit the cuts to Medicaid in this bill. But history is there to guide us. When either party moves unilaterally on health care, Democrats did this. They created the Affordable Care Act unilaterally. They suffered a very big political cost in the following election. Republicans, when they tried to repeal and replace the ACA unilaterally, also, there was a big blue wave in the next election. So healthcare is a very potent issue. It's a dangerous issue for people in office, for the party in power. And Republicans are wrestling with those political threats right now as they try to advance this bill.
Yeah, looking ahead to those midterms. Donna, it seems like there's not much that really Democrats can do to stop this bill. But according to several recent polls, the bill is really unpopular. Are Democrats doing enough to message against it?
Well, I think the most important thing now is, one, some of these amendments that are being offered by Democrats, I think, highlight the problems with the bill. But, should this thing actually end up on President Trump's desk to sign, and that is a big if, then I think it's going to be up to Democrats to really, in every single congressional district all across the country, to tell the story of these dangerous cuts that are benefiting millionaires and billionaires, but not benefiting ordinary working people. President Trump made a commitment on Medicare, Medicaid, and Social Security, and he's breaking that commitment in this bill. And it's going to be up to Democrats to really convey that. This is not a time for nuance. It's going to have to be very direct, concise to the American people. Loss in nutrition programs, loss on energy, loss on Medicaid. There are so many losses for the American people in this bill that it shouldn't be tough for Democrats to really tell the story.
Carlos, as we discussed, Republican Senator Thom Tillis making that shock announcement that he won't seek re-election next year after joining the Democrats in his opposition to this bill. And of course, President Trump not very happy about that. How much of an impact do you believe that Tillis's dissent may have on his colleagues and on the outcome for this legislation? And could this exit actually spell trouble for Republicans in the midterms?
Well, look, North Carolina is going to be a swing state next year. It was already going to be a tough re-election fight for Senator Tillis. So I think this will make it probably even tougher for a Republican. Senator Tillis is a conservative, but he's also a consensus builder in the Senate, Ariel. And that was probably going to help him with swing voters in North Carolina. Republicans now nominate a candidate that is more of a hardliner, then that might make it more difficult for them to hold this seat. And I think if we zoom out even more, a lot of people can lament the departure of senators like Thom Tillis, like Kyrsten Sinema, like Joe Manchin on the other side, members who, despite being either Republicans or Democrats, always try to build consensus, always try to find common ground. Those types of representatives and senators are finding that there's less and less room for them in Washington, D.C. every day. And Thom Tillis's announced retirement is certainly an example of that.
Yeah, Thom Tillis himself lamenting the departure of even his Democratic colleagues who were willing to make some compromises. Donna Edwards and Carlos Curbelo, we really appreciate you. Thank you.